He is just presenting a lecture for the MCCS students in community medicine, and luckily I have few students not from community medicine but from the second year and third year. So what is your name? What is your name? What is your name?
Safdar Ali.
Safdar Ali, and I am assisted technically by Ms. Arvi. So let us move to the another slide. So you can see that artificial intelligence is a very big name and big data is coming in the world, and the world is changing fast. This is considered to be the fourth revolution after industrial revolution, after agriculture, then industrial, and then internet, and now we are in the era of artificial intelligence. And you can see that everything is changing from your hand, mouth, mind, as well as your surrounding. And in a small piece of the mobile phone, the entire 4 or 5 continents information is stored, and that is at your fingertips. Next, please. So the term artificial intelligence refers to a software program that can stimulate a context-sensitive response or a conversation with a human user. So it is basically a software computer program, but it can be as good as a human being talking or other things. And with this you can see that the screen is now showing the everything, whether it is the medical science, it is agriculture, it is community medicine, public health. Even every student has a phone in the hand. In the past, it was just a luxury item, but now it is a necessary item. Next, please. So this is one of the slides which I have randomly taken from the Google, and you can see that GPT-3 and other AI tools are used to study further public health and medical science. Next, please. So this is one where they have used certain softwares, AI tools, and ultimately they have conducted a study in public health to know the future diseases and to treat the present time diseases, and even to increase improve the medical education, training, research, and the hospital management, and even the knowledge of the community for the public health and healthcare. And you can see that how these things are changing in future. You will not see the doctors in the white coat, but you might see full with gadgets of the AI. Next, please. So you can see that how research and results and other things are coming quickly through the AI. Next. And you can see, you can discuss everything with the AI. There are robots, there are chatbots, and there are many tools and other things. Next. And even you can write book, you can write article, so on and so forth. Next, please. And you can see that how Chat GPT is impacting the medical field. You can see it is diagnosis, it is examination, dental care, even community care, and so on and so forth. Next, please. And even the global health is now being controlled not by doctors but by AI tools. And doctors are using for radiology, for cancer therapy, for laboratory diagnosis, and even you can monitor blood pressure, you can monitor heart condition. Next, please. And you look at the future doctor, how it will look. Next, please. And you can have a policy changes in the healthcare or the planning changes as well as resource generation, doctor's fee, hospital expenditure, everything. And you can see from environment, legal, economical, political, economics, and you can set the agenda, you can apply it. Next. And you can see that how artificial intelligence is being used ophthalmology, radiology, dermatology, and you can see that it is going from very poor to excellent, and it has reached to the middle. Next, please. And advancement in green AI for energy optimization. We are using fossil fuels, the hot fuels, but we can have a green energy also. But here I will explain the info-epidemiology. This is a new term replacing the epidemiology, and we have also info-epidemic. Our infodemic means there is a spread like a disease. The information is spreading and affecting communities. If it is correct and usable, then it is good. But if it is misinformation, then it is just like the habit, just like a cholera or any other epidemics is there. Next, please. And look at these artificial intelligence. This is one of the cover of the journal. And look at the hand, present hand, natural hand, and artificial intelligence hand. It can provide multiple sources of information. Even this lecture is being run through the internet, through the IT, through the AI, and I am just uploading this on my YouTube. Dr. Infodemiology YouTube. If you are new, please like it, subscribe, share it, and write comments that what are the new areas we can take. So the internet has made measurable that was previously immeasurable. You were not able to measure the whole world within a minute, but now the satellites, the AI can measure. And information trends over time identify gaps between information, supply and demand. So now the supply and demand is also not part of the commodities but part of the information. And that is called infodemiology. This is now full publication, and this was epidemiology, this is public health, and this is the epidemiology of information. It's called infodemiology. Next, please. So you can see that the infodemiology is basically epidemiological information and describing and analyzing the health information and communication patterns for public health purpose, supply metrics and demand metrics. So supply and demand, suppose you need more doctors, more female doctors, so you will admit more. If you need nurses, you need emergency doctors rather than cardiac doctors, then info epidemiology can give you. Next, please. Metrics means just a chart, just a paper before you that can guide you. That is an infogram. So you can see understanding and improving health. And next, please. Emerging disease outbreaks. The infodemiology can give you kind of information that next 5 months, 6, even this heat wave was predicted earlier, and heavy rains are predicted earlier because of the artificial intelligence model technique and large language models. Continue. So we were just saying that Dr. Infodemiology YouTube channel is giving you latest information of public health issues as well as journal development and other educational, particularly in the health sector. So if you are new, and we are using this tool not only to give education, information, teaching to my students in Israel University, but the students of other universities can access and click. And if you are new, please like it, subscribe it, share it. So we were just discussing infodemiology, means epidemiology of the information. And now the word infodemic or epidemic of information or spread of information is so fast that people are shattered that where to start and where to end. And you can see that some of the hints are there, and these are where I can learn more questions and others. A lot of publications are coming which are available on the net. Next, please. This is very interesting that have you used the internet to look for health information for self in last 12 months? So that was a question asked to the people on the net, and you can see that 65% people are searching information about their own health or the health of the community. Next, please. So there are certain limitations, and you can see that biases as well as some experiences and people what they actually do cannot be 100% reflected to AI, because after all this is a machine learning. So natural learning and machine learning. Next, please. And these are the few graphs and which show that formal education training as well as purchasing goods and services, including and even the medical health information, government information, and you can see that you can browse, you can go anywhere for any information. Next, please. This is demand and supply we have already discussed, and you can see that a lot of top journals are publishing the information on AI and public health. Next, please. So these are some of the important queries. You can see that organ anatomy, injury, neurology, lab tests, gastroenterology, medical and healthcare services and organization, medicines, diet, nutrition, infectious disease, cancer, rheumatology, addiction. So there's a long list where AI can guide and AI can provide you information. Next, please. Daily searches just for a common flu, and you can see that how many people are searching. Next. And outbreak or epidemic of fear, and you can see that this data shows that infovigilance means surveillance or monitoring that can also be done, and epidemic fear can be traced, and public health response and surge in information needs can be organized. Next, please. And you can see that infovigilance, which is surveillance through information or monitoring through information, and you look at how world is seeing this. Next, please. Yes, this is vigilance, infovigilance. As invigilators are in the examination, so you are invigilator on the diseases. So infovigilance is a new emerging field, and data visualization and interested to participate with your side. Next, please. Okay. So with this, I am concluding that infodemiology is epidemiology of information. Infodemic is the epidemic of information. Students, particularly NCPS, XCPS, MBBS, BDS, whether they are junior, senior, can understand the infodemiology, and that should be included in the curriculum, and regular short courses, lectures, and video presentation should be organized in every university. I hope you have liked this video, and waiting for your comments. Dr. Sandwich Kolachi YouTube channel will give you latest, new and authenticated information on public health issues and medical education and research. Thank you.